If you're one of the millions of people who suffer from back pain, then you'll want to hear this. What you may think of as just a part of life or a part of getting older could be a more serious problem.
For the most part, the major cause of back pain in adults is degenerative disease. This can be summarized with arthritis. I mean, it is a type of arthritis, even though it's not the arthritis that we think of in our hands and knees and hips, but it is a type of arthritis.
But in some cases, it's not so cut and dry.
I was in pain every day, from the time I woke up to the time I went to bed. And to go from feeling like an avid runner to barely being able to walk with a cane was extremely difficult.
For Justin Coffeen, an avid athlete and runner, having this type of injury was devastating.
Emotionally, I felt weak, and I felt like my days were just kind of getting by.
Justin is a very typical case that we tend to see a lot of here at Eden Medical Center. He's a young, relatively healthy patient who had a very focal problem, and it was limiting in so many ways.
Once I made the decision that something needed to be done, I kind of decided that surgery was where I needed to go with it. So I came to Dr. Mimran not necessarily to discuss options, but to specifically request surgery. Recovery was astounding. I came in the morning in excruciating pain, as I said before, barely able to walk, and I left, although hospital policy says in a wheelchair, I was able to start walking the next day.
He's just a testament to one patient's motivation to get better, and it also, I think, exemplifies how a very minimally invasive operation that is properly directed at a patient's pain can have very profound effects.
Whether or not your pain comes from aging, arthritis, or an injury, it's not something you just have to get used to. There are many ways to treat your pain.
Generally, the treatment of spine-related disorders can be divided into two separate groups: the non-surgical treatments and then the surgical treatments. And the non-surgical treatments are very, very wide and varied. When people tend to fail those treatments, when people have made their way through the spectrum of care and continue to have ongoing daily pain or any kind of neurological deficit as well, then we start to think of them as maybe being a patient that would be better suited for a more aggressive sort of surgical treatment. And then that is when we would bring some of these minimally invasive treatments into play.
Dr. Randall, why do you think this is a better procedure for the back?
Well, Peggy, today we have a much greater appreciation about how important it is to disturb normal tissues as little as possible in doing these operations. And with the advent of micro instruments and the operating microscope, it allows me actually to do a better job of completing the operation through a smaller incision.
And the benefit to that is, I'm assuming, faster, as we saw, quicker recovery.
That's exactly right. Patients recover faster, oftentimes going home the same day from the hospital, and are back to work much quicker as well. This can become especially important in these economically challenging times when lower hospital costs and getting patients back to work faster can really make a difference.
And is talking about getting back to work and getting back up on your feet faster, is it different from surgery that you do now, or all surgeries done as far as minimally invasive when it comes to working on the spine or the back?
The principles are all the same, that less is better. And if someone doesn't need an operation, that's the best. If an operation does need to be done, doing the least disruptive procedure that accomplishes the goals of, for example, taking pressure off nerves that are being squeezed or fixing bones that are unstable, the least involved approach is usually the best.
And you can use these minimally invasive surgeries on, you were talking about, it sounded like all different types of problems involving the spine.
We do. We treat neck problems, low back problems. With our aging population of people who still want to stay very active, it's not unusual to have people in their 80s or even 90s sometimes who are frustrated that they're not still out on the golf course, and we can oftentimes return them to those kinds of activities.
Yeah, absolutely. Whether you're young or whether you're old, you want to be as active and especially a strong back as possible. I know we've covered a whole lot of things from, brain aneurysms, strokes, brain tumors, and now, what probably affects a lot of people, back pain. What would you say as far as in neuroscience would be the future of kind of an overview of all this, the future of any one of those treatments or all of them?
Well, the future of neuroscience in general is really exploding. There's a huge amount of work being done in the laboratory in terms of basic research and also in hospitals in terms of clinical research. There is work using sophisticated computer problems to understand how complex problem solving is done in the brain. Functional MRI scans are showing us how brains are working in terms of emotional responses and those sorts of things. There's really a whole range of research and clinical work that's being done. It makes it very exciting.
Yeah, and the bottom line is these don't have to be the big, scary, end of the line, diagnoses that they once were.
Well, that's true, and also the fact that we are constantly developing new techniques, whether it's through surgery or pharmaceuticals, that make conditions that have traditionally been quite challenging to treat, such as Parkinson's disease or Alzheimer's or stroke, much more manageable. And I think that in the decades to come, we're going to continue to see great progress.
Thank you so much for joining us today.
Peggy, it's been great to be here. Thank you.
Sharing everything with us. When we come back, we will tell you how you can find out more about the brain and pain treatments that we showed you today on Your Health Matters.